could be and not being here.
We're here now.
Yeah, I am. I'm so sorry. It's not at all.
Answer it. Answer it.
TSC, can
No,
you hear it?
weird.
Do it in an accent.
Yep, I can hear you.
Accent.
Love, all right.
It's weird because
Thank you.
I keep getting these. Like, I think my
Hello, can you all hear me?
Yep, I can hear you.
Oh, good. I don't know if they can though.
I think they're muted right now.
Oh, can you guys hear us?
Yes, can you hear me?
Yes, Kate, how are you?
I'm all right.
Good. Worried about you.
Good. Okay, so we've got, just look and see who's here. Here we go. Okay. Well, it's 4:30 on the dot, so we might as well get started. Everybody, you guys have an agenda. I sent it out online and I have paper copies. I think I handed out. Oh, yes. Everybody have one?
Yes.
So the first thing, I tried to organize it a little differently to give us sort of time slots, but I will try my best to keep track of. So from 4:30 to 4:40, I just wanted to talk about the minutes that I prepared for the 2 meetings that we have had. So we've had 2 meetings. I prepared something that sort of summarized our comments and just wanted your feedback. If you want to approve them, then we could stick them on the website. I don't know that I will be that detailed going forward. We're only required to have a summary and to say like who's here and if there were any votes taken. But I added some detail in the last couple. I intentionally did not attribute comments to individuals, like so-and-so said this, and so-and-so said this. But I can do that if you want me to. I kind of thought it was better not to. And they're certainly not verbatim.
I don't think we need detailed minutes. I think if we get the flavor of the meeting and if decisions are made about, you know, who to contact next or what to do next. I really like the homework section, by the way.
Okay, good, thank
I
you.
guess that's just the.
Well, in case for me, I need that sort of reminder because I so if you guys are okay with that, I don't think we need a vote. We're just supposed to have these. We go above and beyond because we have these meetings televised. And so we're certainly transparent about what's going on, which I love the fact that we are having these kind of work session meetings in public and people can see how the sausage is being made. Hello, Ruth. Sorry, that's okay. So if you guys are okay with that, I will keep doing those summary minutes that way. Any questions?
No, I like the
No.
detail.
Margie, I just have like a copy edit. I'll just send it to you if that's okay.
Yes, if any typos, by all means, send me those if I had an error. And I will get it fixed before, and then I'll send it to Dina and we'll get them up on the website. All right, if there's nothing else, then we'll move on to that. We are, guys, 7 minutes ahead of the agenda already. But what I wanted to do was go over Jeff McKim's abbreviated list of action steps. So essentially, I sent that to everybody electronically. What Jeff McKim did when the reports first came out, and the reports, just for everybody's knowledge, they are on the website and available to the public and have been for months. Jeff McKim read the reports and did kind of an Excel spreadsheet summary of the recommendations, which helps everybody because they're long reports, and it's easier to then sort of see what is it that these consultants told us that we were supposed to be doing. I sent you guys the list of recommendations, and he has some, and I highlighted them based on, I put like a blue highlight based on the facility recommendations. And because we had that great suggestion at our last meeting, which was, hey, let's take the facility, break it down into its component parts, and then talk about sort of who should be involved in those areas, either designing those areas or operating those areas or consulting on those areas. I thought we might talk about facilities today. And so when looking at Jeff McKim's list, I highlighted just the facility recommendations, because there are a whole lot of recommendations in this report that have to do with all kinds of things in the criminal justice system. But just for purposes of today, I wanted to talk to you about some of the facility recommendations.
Margie,
Yeah,
is it possible to share your screen for those that don't have access to the document?
my computer is not. I don't know if I am hooked up. Let me ask, hey, Kim.
I can probably share my screen if that helps.
That would help, Kate. Because I don't think my laptop's. Oh, look at that. Okay, we got it, Kim. I didn't know if that was set up. Okay. Great. Okay, so this is Jeff McKim's list, and I took off a lot of the fields he had just so that we could concentrate on the recommendations. So the first one, Monroe County should collaborate with justice system and community stakeholders to identify options and alternatives for safely reducing female bookings using expanded use of citation, pre and post detention diversion. So we knew, we heard in this report that our female bookings were on the rise. We don't know why. We've talked about, we kind of like to know why that's going on. But one of the recommendations was we should look at alternatives, expanding use of citation and then pre and post detention diversion. Stop me. I'm just going to kind of go through these. Stop me if you want to talk about one in particular. You have a comment. By all means, this is a free for all, and in the sense, don't be polite.
The purple represents what?
Those are just the highlights of the facility. I was just highlighting which ones are facility related.
And if anybody wants more information, we'll go back to the study and find it. Too.
Yes, absolutely. So this is just, it was super helpful for Jeff to do this. He just excerpted the recommendations and put them in this kind of spreadsheet form for us. But yes, all of the detail for the report is in the report, and those links are on the website. The second purple is the jail booking area needs to better accommodate implementation of post-booking diversion and release. We need to ensure jail bed capacity, ensure jail physical environment consistently accommodates and maintains constitutional levels of inmate care and custody. I don't think any of those are surprises to anybody. Jump to this next one that says county officials should complete a study that compares the capital, maintenance, and operating costs of renovating the existing facility versus new construction. A primary focus of the study should be on creating a jail that produces outcomes that are consistent with criminal justice and community needs and values. Now, my question that I want you guys to, I want an answer to or your thoughts on, does anybody think we need to study renovating that facility? Julie?
So my concern would be the cost at getting a study done to see what a renovation would cost.
Yeah.
And the time.
Yeah.
Those are two things we don't want to waste,
Mhm.
time and money.
Mhm.
I think, if our current jail were in a different physical configuration, not on multiple floors, not above, or, then I would definitely be saying, yeah, let's look at renovating and see what the cost would be, but I just don't know how you do that.
Mhm.
And I know some creative people who do architecture, but I don't even know what they would do with that.
Do you think that there's a difference between analyzing that building for future use as something other than a correctional center? Versus, so maybe I'm not going to spend the time and money to analyze it for future use as a correctional center, that I might see about repurposing it for office space?
I don't know that that's the purview of this committee. And it may be, but I certainly don't think it's our purview now, but that's just my opinion.
Sure. Okay, so, but, go ahead.
I was just saying, I totally agree with both points that Julie made.
So I think the purview of that is more of a commissioner purview. Do you agree, since commissioners are in charge of facilities?
Yeah, right.
Yeah.
We do space needs analysis and, yeah, but we don't, until we know what's moving, we don't know what we have space for, or what we're gonna have left. I mean, I think that's cart and horse in this case, yeah.
But so but the takeaway is, let's not spend the time and money to study renovating because the configuration is, we already know inefficient.
And also, it doesn't allow any kind of outdoor access, which I think would be very positive.
Yeah, and I think all along we've said that with a new facility, we want to have outdoor space, recreation, places where people can get outside and be a little hopeful, right? And you just can't do it right now. Okay. Any other thoughts on that particular one?
Only that the preceding language in the Ray report confirms what has already been said as well.
Okay. And we've been told by the ACLU that they think, we've heard this before, we have the worst designed facility in the state.
Actually, his words were the dumbest design.
Dumbest, okay.
Not in the
Yeah,
nineteen
That's
eighties.
kind of worse.
In the 1980s, it was not.
Yeah. Yeah, but it was because they claimed it was something that it wasn't.
Well, and, you know, I've had conversations with Charlotte, CeeLo, that she said it was a compromise at the time.
Mhm.
And because
point.
people didn't want to leave downtown, so it was,
Mhm.
they already knew that it probably wasn't
Mhm.
the best design. So the next one is obviously the work that we're doing here right now, is trying to develop a strategic plan that guides the timely implementation of a sustainable facility to ensure and maintain constitutional levels of inmate care and custody and facility safety and security. That's one thing that we're doing. We are focusing on Intercept Zero and community services, but we're also at the same time trying to focus on facilities. And I want to say that I think it's important, and I want to make sure you guys agree. I think it's important that we try to juggle both of those things at the same time. I've heard some of you say, maybe all of you feel this way, let's not get so sidetracked with the facility that we forget about mental health and addiction and treatment and the community connections. So we've got a challenge and work to do, but we need to keep both balls in the air at the same time. You guys agree?
Yes,
Okay.
these are great softball questions, Margie. Keep them coming.
Yeah, you guys are looking so intelligent.
Can I show you another question? No.
So the next big long block of color is kind of more of the same. Taking immediate steps to study the feasibility of maintaining the current jail. I think we know that we are working towards a new facility. And I've roughly heard this timeline, which is think about finding an adequate location in 2022, design in 2023, build in 2024. Is that me making that up or hearing something? That's not?
Jeff Cockrell said that when he was here last time.
Yeah,
When I was up in the June meeting, the early June.
So that's still what everybody's thinking.
but he did think some design components could be finished in, what was it, 45 days?
Yeah, so I think one of the things, yes, I remember that 2 weeks. It's something about, doing this in pieces instead of all at once, and how things could move more quickly with some aspects and slower with others, and.
Yeah.
But you sort of have to have the overall development plan before you do anything, so, yeah, that's obviously gonna be the first thing we need.
Okay.
And according to my notes, that I have a handy dandy notebook for everything. I think I got that the completion was supposed to be between 24 and 26.
Okay,
Yeah.
okay.
Yeah,
Which is a
with
little
the
more
first one,
realistic.
Yeah,
first
of
one in
course.
24, and then rolling
Right.
through, yeah,
Yeah.
that does sound right.
Okay.
Yeah.
So things would be rolled out over that 2 year.
Mm-hmm.
Okay. Alrighty. Now here's the one that I think is more interesting and creative in the sense, and gives us some room to talk about. I wrote in my little margin, love this. So Monroe County officials and citizens must clarify and re-envision the fundamental purposes of incarceration. Humane and constitutional care and custody of incarcerated should be the lens from which clarification is focused. The jail facility should be replaced with one that consistently accommodates more cost-effective operations while ensuring durable provision of constitutional care and custody of incarcerated persons and safety to staff and the community. Just last night, I had the chance, and Jennifer was there, Reverend Grants were there, we were at the NAACP meeting. And safety was something that was stressed. I think you were the one that stressed that. right?
Yes, sure.
For the residents of the community.
Well,
Safety and
not
security
not
for-
only for the workers in the jail
Yes,
and the inmates.
okay, so all three, really,
Yes.
yeah, okay, I like that.
And there is like that distressing news out of Jackson County
Yeah,
that we need to
last
keep in
year.
mind as well in this regard.
Does everybody know?
No,
Yeah.
tell me about this. I don't know.
So last summer, there was a young Black woman that was from Louisville, Kentucky. And it made national news. And so essentially what happened was she was saying that she wasn't feeling well and was getting sick. And other inmates that were in the room said she was getting sick and she had all type of issues. The folks in the jail thought she was joking and didn't take her serious. And then she progressively got worse and her condition got worse as it went. And by morning time, they eventually believed her and took her to the hospital. But as they took her to the hospital, she passed away. And so that is something that it blows my mind to think about. And I mean, we all know that we had, it's been said before, we've had the Taze incident. And if it has happened once, and it can happen anywhere.
Right.
So yeah, definitely keeping the safety of those that are incarcerated in mind,
Mhm.
as well as staff is a big component with this too.
Mhm.
Well, and I think that's important because, we talked a little bit last night at the NAACP meeting about schools too. And, in schools, it's in loco parentis, you're in the place of the parent. And I feel like they're in our custody and our care when people are in our correctional center. We owe them the responsibility to care for them well when they're in that facility. And it was mentioned, having technology and having cameras and having regular, and Sam, I don't know if you want to jump in here with any thoughts that you have about things that we might do differently or better. But yeah, nobody wants to see that happening. in
Yeah.
Monroe County, and we have to ensure that that doesn't.
And I was gonna say, I think that's transparency. Because, I mean, we all see on the news, like what happens between, this person and this person and, all of a sudden it's convenient that, there's no body camera. Of course, not accusing anybody of turning anything off by any means, but if we have those protocols and in place to make sure in the next facility that is something that we have, in the event, knock on wood, that something would happen, we could always go back and say, this is what we have, this is the transparency, this is all the protocols, everything that, we had in place, so that nobody can say that, oh, well, this wasn't done, so now we question this. I'm sure people will find some type of way of questioning something, but as long as we know that we have actively gone through that list of everything, we can confidently say that we're good in that respect.
And that makes me think that as we go through the process to design a facility and get community input on the facility, we do like a charrette, that we go through those lists and we aren't, it's
Mhm.
not just us building
Yeah.
that list. It's our community. building.
But Sam, we do have body cams on all the jailers, don't we?
I don't know if we have them on all the jail officers,
Okay.
but the majority of them.
And I'm sure body
body
cams
cams.
aren't adequate totally on their own, but,
Um, or
what do you think?
I think they're a great tool. And I think they've already proven themselves to be a great tool.
Good.
The staff don't complain about having them. The staff realize it is something, that it's a tool to protect them
Mhm.
when they're interacting with the
Mhm.
inmates. The only thing that I can say about the body cameras is there's a little bit of a failure on staff.
Yeah.
Occasionally to turn it on. You know, especially if something happens really quick, which is possible in the jail environment. But for the most part, those body cameras are great. And then we have 180 cameras.
Yeah.
Fixed cameras throughout the jail. So
So do you not have enough body cameras right now for everyone?
we have enough for individuals per shift. But we don't have enough to issue one to everybody. So they're
Is
having
that
to
a
share.
problem?
Oh, it would be great if every person had their own body camera. And I think, you know, it's like anything else. If you're issued a computer, you're going to take care of that computer and you're going to be responsible for it.
Yeah.
If you have to share that with 5 other people,
Mhm.
there might not be as much accountability. So yeah, if we had a body camera for every single person, then there would be more accountability for that person to take care of that tool.
Would that be something you would foresee continuing in a different jail environment?
Oh, definitely.
Okay, great. That's good to know.
Yeah.
Good, we can look at that.
I just wanted to mention in the Ray study, which is extensive. As it pertains to this purple item that we're talking about now, they identified 53 problem areas. And in these 53 problem areas, it wasn't that Commander Crow was being delinquent or sleeping on the job, or whatever. It's all facility based.
Yeah.
And it's things that I think that at least the facilities that we've toured and seen, certainly we could address.
Yeah, I mean, we're stuck with what facility we have. And we can't retrofit it to do what we need it to do.
And additionally, as we go on and have charrettes or community conversations, I think that list is a great starting point that we can add to.
Okay. Kate, do you have anything?
No, thanks. I'm good.
Okay.
By the way, whoever's taking notes on the screen, that's on page 85 of the Ray report.
So, and this also makes me think, you know, when we get to the heart of the agenda, where it's looking at the various pieces, and Sam and I talked about what are the various pieces of the correctional center. I do want to think about who is it that ought to be for sure be part of the conversation. And it may end up that we picked the same groups for every area, but there may be some particular areas where we need to consult different people than in other areas. But I also want you to think about, when we're thinking about those areas, think about if we're your child who were being taken to this correctional center, how would you want it designed? And I use the example of the Sallyport because that's where we had the problem before with the Borden incident. And that person was under medical duress and had been dealt with in Lawrence County earlier in the day. And I wonder if, you know, if we think of it as just as a place where pulling in a car and dropping off a person who goes into booking, that's different than if we think of it as this is the first time we're getting to see the individual and we're going to make an assessment and we got to make sure that we're meeting that person's needs. So I think, again, think about it, if it was your child being brought in, what would you want to have in place so that that assessment was made? And Sam, do you have anything that as a?
Well, I think practicality. I really think jail staff ought to have some input on design features. Because they're the ones that are there every day and walk the steps and
Yeah. they know.
utilize the areas.
Yeah,
When you start talking about the Sallyport, again, our Sallyport is dysfunctional the way that it's designed. So I think you might talk to patrol officers,
Yeah, for sure.
Yeah.
you know, people that use it. And I'm not talking about chief of police or the sheriff or administrative people. I'm talking about people that actually go in there and use it. And the boots on the ground.
Yeah, that's great.
maybe let them know in advance that we're interested in that so they can kind of think.
Start thinking about it, yeah. Well, because again, I think it comes back to everybody's safety, making sure it's done.
Yeah.
How can we best effectuate that kind of interview process? Is it a survey? Is it interview? Because then you can ask follow-up questions. Who can do that? I just feel like we should make sure that we're, audio recording these things, so we don't want to miss anything. We don't want to lose any information. So
Yeah.
we probably should think about how we're going to do that. And if we can, bring someone like CGM in and
Yeah.
pay them to do it, I'm sure they would do a great job, but
Yeah, and it starts early. I think about when we were designing, and this was the city, the county, and transit, but when we were designing that dispatch center. And we did have staff input at early on with the architect. And we had regular meetings, like weekly meetings, throughout the entire process. But we were thinking about things like, oh, we have turnover in dispatch. Maybe we have turnover because they're sitting in a room with black trash bags trying to be the vents. And there's one bathroom for men and women, and it's like right behind my chair. And when you get the opportunity then to go work somewhere else where there's a better facility, you're gonna jump at that chance. And so we were like, okay, what do you need? Let's do a balcony so they can get outside and see, some, the sun. And let's do different bathrooms. And so let's have a kitchen, so I do think that Sam's right. We have staff input. And it's got to be facilitated, and I think we have to have the design and perhaps have those people already hired and on board.
I do have a suggestion
Mhm.
for that. I know we had previously talked about kind of looking at the different components of the building.
Yeah.
And I saw the list that Commander Crowe made, and that was, I think, really helpful. When we talk about the Justice Campus, though, there's so many components of it. I made a list, and to me, they're all intertwined, which also gets to balancing the community needs and values that we're trying to connect with the facility. Which includes not only the jail, but the courtrooms, judicial offices, all the administrative offices, the public defenders, prosecutors' offices, and I'm happy to send
Yeah,
this
that'd be
list.
great.
But I think one thing that we could do that would be helpful to make sure we hear from the people who are in those sections is if we have meetings that are by a particular topic. So I would suggest after we have the Stride Center meeting and the 988, we could do first a jail process overview where we have a presentation by the jail, just to explain what some of the terminology is. Then anyone who hasn't done a jail tour could do a jail tour to be able to kind of put those terms to what we're talking about. And then one example would be then to move to a meeting specifically about the Sally Port intake and booking. Everyone could participate in a ride along so they can talk to some of those officers and see what some of their experiences are. And then also speak with those road deputies, additional ones through a mechanism that be established by the committee, but jail staff, and also including public defenders for some of the experiences they've had and they've heard from their clients. And then I made a list of some other areas to incorporate. For example, temporary holding areas. We could include conversations with mental health providers in the jail, which also helps us understand the places that they may have needs to connect to those community partners. And then one more, and then I'm happy to send the list that I'm kind of proposing, is including a courtroom section where we talk about things like accessibility, which is not only technology, but the report specifically mentions other types of accessibility. I can tell you, I've had individuals who may not be able to hear all the proceedings. What are we doing to make sure that there's accessibility if there's someone who's injured or disabled? In addition to the courtroom, transportation, safety, and I know that our office would welcome anyone who'd want to sit in court with us for different proceedings to walk with us and see what the courtrooms look like and some of the challenges we have based on the facility. And even, having those conversations with public defenders, being able to spend some time with some of their experience was something else that I would suggest, which would be a way to talking to the people like Commander Crowe suggesting who are dealing with it on a day-to-day basis and finding some of those gaps where you can share the resources with the community.
That's fabulous. Yeah, I think that, and you, Erica, you and I have talked about kind of courtroom design. and how our current courtrooms aren't like fabulous, you know, we could do better.
Yeah, there's a lot of concerns, like not just efficiency of presenting evidence and processing cases, but there's also some safety concerns with the way that they're laid out. And so I think it'd be good to probably look at some of the facilities and some of the modern technology as well that makes it a lot more efficient and easy to, publish exhibits to the jury and these sorts of things.
Yeah, and I think I would love that list, April. That's excellent because, and I love the idea of a jail tour that came up last night in our meeting.
Yeah.
And people are eager, I think, and Sam will have to figure out how that works, but I think you'd have a bunch of people who'd be like, I'd love to see that. And I think that's how you get the community to be like, yeah, you guys are right. You need another facility. Because I think they walk in there and they're like, yeah, we could do better.
I think for the most part, everyone in here knows that I'm pretty eager to give jail tours. Because people need to see what the jail is.
Yeah.
You were gonna say something.
Yeah, I think the other thing too is there's access to education and healthcare, mental health care, substance use care for inmates. But I'm also wondering if we could get somebody like CJM or somebody to do some interviews with family members and friends of people who are incarcerated about what that, the visiting, the contact.
Yeah.
You think about people with families who are incarcerated and how do they do that? They have kids, they have,
Especially
partners,
women with children.
yeah, and how can that be done differently if we have the space? Because clearly we don't have the space right now, but and then that access to technology in between times, right? And what does that look like? What's safe, what's possible? We have a system now, with iPad, basically iPad rentals and things. Is that something we want to continue? Is there something better? And honestly, we've heard time and time again about the phone call situation and how it does not cost what people are charged for those phone calls. And I really wish we would do something about when we're in a new facility, when we can do it, to do something about making those local calls free. Because
Well,
they,
yeah.
this is, to me, you put a timer on it, you do whatever, but to me, this is just fundamental in terms of a family dealing with
Keeping the
situation.
connection.
Yeah.
Well, and that I think, how I feel, I'm a big proponent of the commissioners and the council using the control that you have when you approve contracts and when you approve funding, say, here's a string that's going to be attached to this approval or to this funding. These are the things that I need to have in here. And I'm not sure that is, I'm not sure that there is a contractual issue here, but if there is, let's figure out where that is and let's see what we can control and what we can't control. And so, who I think about, and, I also want us to be thinking too about who are the partners we're working with and who are the relationships with community organizations that we're building. And it makes me think of Mary Getsy, who runs this thing called Kids with Absent Parents. And they get, there's a lot of stigma. I've met with her and she said there's a lot of stigma because people say, well, you don't understand, you've not had a loved one or a spouse or partner in a correctional center, and then the kids feel some shame. And so she gets them together so that the kids can talk and the parents can talk. And wouldn't it be lovely if there were space when we build so that there can be meaningful visits? And you have a reaction.
You have to remember though, this is a jail and these people are in here for a reason. And I can't tell you how many times when we had face-to-face visits where people would try to bring things into the jail.
Yeah.
I mean,
Sure.
safety has to
Yeah,
be the
absolutely.
utmost,
Yeah,
the
but-
top priority.
But that's why I'm just wondering if there's some other way to effectuate it. There's some new technology that we can use where they're in the room, but they're not connected, like they can see each other, but they can't exchange.
So when you start getting face-to-face and contact.
Yeah.
People are deviant.
Yeah.
And they are they're gonna use their kids to bring things into the
Mhm.
parents.
Yeah,
Yeah.
Unfortunately. but
it's
that's-
sad, I'm sure you know that that's possible, I just don't know if there's some way to do this, and if there is, we
Yeah.
should look at it.
And, you know, I'm all for parents, children being able to communicate. And we're trying to do things now to make sure that happens, like the Read to Me program.
Yeah.
Um,
And that was one that Mary had started
Yeah.
and she would videotape them reading books.
Yeah.
And
we're
Yeah.
still, we're
Yeah.
still doing that. They've got a backdrop. They have clothes that they can change into, so you don't get that
Yeah.
atmosphere.
Yeah,
in
yeah,
the jail. So
Yeah,
we're
that's
trying to
nice.
do things
Great.
like that. And
Yeah,
I'm sure there's other things to do,
yeah,
but we have to remember that safety
of
component.
course.
that's it. And
Safety
I,
first, for sure.
What about
Margie?
technology?
Kate,
Oh, I'm
yes,
sorry. Kate.
hold on, I'm sorry. And I'm not paying attention to the chat. Go
There's
ahead.
well, that was part of what I was gonna say, is there is some stuff in the chat that's very worthwhile. Specifically remembering to talk to folks
So here, I'm gonna read it out
incarcerated,
loud.
and that perhaps, well, okay,
You want me to read it out loud?
that's fine.
What was your idea?
Well, just that we're talking a lot about a lot of different groups and how we can hear what they have to say about the proposed campus and its services and its structures. And these different groups need to be engaged in different ways, in ways that they're comfortable with. And as Ms. Bird says in the chat, a lot of people won't talk unless it's anonymous. So if we're, going to reach out to populations who might have some privacy concerns, we need to keep that in mind. And I think it is important that we reach out to that. I know we mentioned families, but also those who've experienced our current facility probably have important perspectives to add. And there was something else I was going to add, but I forgot what it was. Sorry to just blurt in.
No, that's perfect, because no, that, I appreciate it, because I needed my attention brought to the chat, I wasn't paying attention. So so it says, can we please talk with people who have, who have or are currently, have been, formerly incarcerated. Also, family members, many people will not talk unless it can be anonymous. Please consider holding focus groups in the jail with inmates, also previously incarcerated. That's a great point. Remember, we had the Indiana Institute on Disability and Community, they were willing to do a survey and work. They'd taken a survey used in another country and modified it for our use. That may be something we want to think about and pick back up on. We had talked with you, Sam, and with Sheriff Swainevent about it. We might want to have that conversation again, because I do think it would be good to get their input. There are so many people who are incarcerated who should not be there. And how is the task force going to keep that consideration at the forefront? And that should be a primary concern. Not building more room, spending millions for nicer things for folks who should not be there to begin with. Absolutely. Go ahead, Peter.
I was just gonna point out the next purple square addresses part of that point.
Okay, good. Okay, so let's get to that.
One other thing I
yeah.
want to say, I've had the opportunity to go to a couple conferences in the past few months. And there's a lot of talk about building new jails. And these are national conferences, so it's not just something that's happening here in Indiana, it's all across the United States. The National Institute of Corrections, it has a program for the building process. So it would probably be a good idea to get in touch with them. I know this Franklin County Jail, they had a lot of input in that jail. And might be able to get some tips from all across the country rather than just here in Indiana.
So it's a community, it's a process, not just of the building itself, but the community process of engagement. Oh, that's
Yes,
great. Okay,
yes.
great.
Very good.
and it's free, which is really nice. And they might be able to send someone here to help with these groups.
Great.
Absolutely. So the NIC, National Institutes of Corrections. And you and I had talked about that. Maybe they had grant opportunities, right? So the next one said the need for pretrial space should be considered when conducting the facility. And then the one I'm thinking that Peter was talking about, explore the bounds of permissible uses of tax revenues for corrections and public safety to support efforts to reduce incarceration by implementing non-law enforcement crisis interventions, using alternatives to incarceration, and improving treatment and reentry preparation. Part of the Eve Hill study was she pointed us to this diversion to what, and it had evidence-based mental health services that prevent needless incarceration. And one of the things that I want to point out is that she had said, talking about mobile crisis services, which is something we've talked about, and Linda Grove Paul is going to come to our meeting on July 20th and talk to us about 988. Instead of calling 911, call 988. And within this information that Eve Hill had given us, said that studies have found that mobile crisis teams resulted in arrest rates ranging from 2% to 13% of clients, in contrast to an arrest rate of 21% for typical contacts between police officers and individuals with psychiatric issues. And so I definitely think that those are things we're going to have to think about. And I think, isn't there, Erica, you and I talked about that, there is some effort already in play to work on sort of some of those mobile crisis teams.
I think they have a few people who are doing some sort of trial, like soft runs on 988 with an idea that we're gonna expand it and improve it.
And Linda would have
Yeah.
more information because it's through Centerstone.
I did meet with Linda between the last time we met. She actually came out to my house. We had a lovely conversation, socially distanced, and she was able to share some information with me. And I said, invited her to come to the meeting on the 20th. She's going to share some of that. But I think they're working through some of the issues and they're doing it on a trial basis now. And so, yes, exclamation point, we absolutely have to work on trying to prevent people from, there is a working group. Check.
But that's something that we don't need to be concerned with planning around. I mean, they're doing that work, it's getting done, it will be there, right?
Yes, we need to be aware of it.
We need to be aware of it, but
Yeah.
we're certainly not participating. Okay,
Yeah,
Maybe
we're-
aware of any needs they have.
yeah.
yeah, and she's gonna talk
Yeah.
also about, Stride Center and how that, how to keep that going, what her thoughts are about keeping that going. Their funding runs out the end of this year. So, yep, Centerstone as a pilot. Yep. And so Linda will tell us about that again. Monroe County government, I don't think is going to solve every single issue, but we can be aware of and be good partners and see where we can collaborate. That's a value, I think, of ours is collaboration. And who we can partner with and how we can encourage. And also, I know you guys are thinking about health in all policies. And I think that that's part of these conversations is just how do we do things to promote health and wellness and resiliency? And obviously preventing somebody from being incarcerated and getting them the health care they need, the mental health care they need is a step in the right direction as opposed to incarcerating. Okay. Okay, let's look at the time. Hold on, let me get back to my agenda real quick. So we're 15 minutes over now, guys. So question for you. Do you want to continue with this list and finish looking at the blue highlighted things and then move on to the facility discussion, or would you like to jump to the facility discussion? Peter?
It is my opinion that we've talked about all of the blue boxes already.
Good, you read ahead. Were you the kid in class who always read ahead?
And I need an A+ or a
Yeah.
gold star.
I'm gonna print stickers, 'cause I was always the
Margie,
kid
that would
in
really
class.
make me happy. Yeah.
Especially when it's got a little smell. to it.
No, no, oh, that gives me a headache.
So let's jump to the facility discussion. Sam and I had a conversation and he broke down for me sort of what are the various areas of the jail. And I want to think about these areas and think about what are the programs that are going to happen in these areas, or what are the activities that happen in these areas? And then who are the partners that you think could or should be involved in designing, operating, being involved with these areas? So we have A through J, and I have K as other. So just to go through that, we have the Sally Port, the intake booking, the temporary holding areas, processing, the housing areas where people live, central control, which is the central location where everything is safely monitored, administrative offices, medical areas and offices for medical personnel, classrooms and flexible meeting space. And I think that's a super exciting topic when we get there. I think we can really dream about that. And then exercise space indoors and outdoor.
How
So
about detox?
I think it's at a temporary holding
That's
area.
probably
That's
going to be in
temporary.
the temporary.
Okay.
holding area.
Yeah,
I see.
detox is like a temp, but again, we've long, I know as a county attorney, most of the complaints that I've ever had about, you know, when somebody calls in to say, hey, I don't like the way this happened, a lot of them were complaining about detox.
Yeah.
And again, we're just kind of stuck with the facility we have.
And detox is different if it's alcohol versus a drug, because drug detox can be much longer term. There are different medical impacts of both, so I think we need to think about that too, right?
Well, we've also discussed detox being kind of a separate facility. Which,
Yeah, and you know, towards the end, I'm gonna share with you some thoughts that Peter Ben and his colleague in Hawaii have come up with. I'm convinced that we've got to make sure we're working with mental health professionals when we are designing and building this. When we're thinking about mental illness and addiction, we have to build good treatment into the facility. And we've said we can't divorce programs from facilities. And so I'm no mental health professional, and we've got to find people who know more than we do about those and can help us. I also think, you know, again, Peter has studied, is local, has studied addictions his whole career. His partner in Hawaii, who got his PhD here, has spent 9 years in prison. The person of color spent 9 years in prison, was addicted to heroin, then came here and got his PhD and is working in addictions. And so again, we talk a lot about finding people with a lived experience. And I think that's huge to bring something like that. to
Yeah,
our team.
I think one of the things that I'm curious about is whether it's the same building or an adjacent building. And that to me makes a difference.
Yeah,
yeah,
You know?
even if it's not, I mean, what if it's, you know, just sort of
A different,
connected
a
or,
different wing is not the same as with the population, right? And so I don't know what the answer is to that. I just think we need to think about physical space
yeah.
in that way.
Yeah, I think that getting thoughts about, because, you know, there's so much stigma attached to those issues, like what's the best way to design? I don't know the answers either.
What do you think, Sam?
I don't have the answers for that either. I mean, I've been in jails where they've had more holding type areas where they can separate people based on alcohol addiction or alcohol intoxication, drug intoxication, battery holds, mental health holds. So I definitely, if it's in the same space as the jail, I think there needs to be enough appropriate areas where we can separate all those people. My concern, if it was separated, if it was a different building, you're looking at more staffing.
Mhm.
You know, we're pretty fortunate right now. We have 2 mental health providers full-time in the jail.
Yeah.
So they go down to our first floor and they see people on the first floor daily,
Mhm.
you know, Monday through Friday. They're not here on the weekends, but they see them daily. So if that was in another building,
That's
you would
very
probably have to have other staffing in that building.
Gotcha.
Whereas right now they're utilizing the same space. They're seeing those people down there. And then they have the opportunity to go see other people throughout the rest of the day.
Yeah.
So I think there's a lot to look at in it.
Yeah, so a wing versus a different building but that also, you think about food service, you think about, supply, think about staffing and cameras and security systems, that all sort of says same building, but.
You know, and if you
If
can,
it could be a part of the campus, but not actually attached.
I still think you would have issues.
Uh-huh.
You know, one of the design features that we've seen, we're going through some of these tours, you have a central area, kind of like this table. And this is your booking area. Then all the way around it, you have cells or detox areas, holding cells, individual cells, group cells. I think something like that would be appropriate. And that way we'd still have access to it. We would still have the staff there monitoring those people. We would still have easy access for mental health.
And I'll add that when we were on those tours, the feedback we got from the staff there was that it does reduce the amount of staff you need to ensure safety. And for those of you who did not stay up and watch the last county council meeting, we are really hurting for staff in our jail. And so to suggest that we're going to build a second facility and staff it adequately, safely, and constitutionally, I think that's a stretch. And then even to go so far as to say, if the labor market continue or loosens up, if it's not as tight as it is right now, that the county has the resources to expand its labor force by that much. I think we are already looking at a very expensive building process for a facility. And then on top of that, expanding a labor force, I think that gives me a little bit of pause as a county council member.
I agree.
Yeah, totally makes sense. And I do think, again, some of the comments that we're hearing in the chat, again, how do we work ourselves out of the incarceration business and truly treating people with mental health issues outside of a correctional center? Eve Hill said over and over again in her report, we have a shortage of mental health providers in the community. And, that's another reason I like the idea of working with the university. They're training people in all kinds of areas to be practitioners. I don't want to lose that talent and people leave Monroe County or leave Indiana. I love the idea of, we just built a hospital with a nursing facility next to it. Why don't we work with the university and say, what kind of clinical space do you need to train people to work with mental health and addiction issues? And let's figure out how to build our talent and keep our talent here. Because again, I don't know, there's a summit that the JRAC, so the JRAC is that other group that is statutorily required to work on these issues. There's gonna be a mental health summit October 21st. And if there was a perfect model out there, I don't think they would be having a summit to say, hey, let's talk about this. So we're building a new facility. We've got a great, clean slate. We've got resources. Let's get creative with our university and those people that we're teaching, whether it's School of Criminal Justice, counseling psychology, social work. Go ahead.
I think the other thing that has just been something that I've thought about for a number of years now is just how important it is to provide this kind of help for people so that they don't end up in the criminal justice system. And maybe there's a way to do a building that's there and sort of attached to the clinic side of it, where people can come for help so they can be diverted.
Yeah. And you think about Health Net is a good partner, and who are also Center Stand's a good partner.
Erica, how frequently, or does it ever happen that people who have been brought in for mental health issues aren't actually charged?
We usually don't get anybody brought in just
Just
because
for-
they're having a
okay.
mental health issue. A lot of those are going to the Stride or to the hospital.
Uh-huh.
What we are seeing, I think, a pretty significant uptick in are people who have been on the psychiatric floor of the Bloomington, Ivy Health Bloomington Hospital, who end up getting arrested off the site floor out of mental health commitment because they have harmed staff there. And so I don't know what the answer is. I can tell you that I have some pretty grave concerns about mental health and how to treat it. I think, I think we're gonna need some help from the state on maybe some, some kind of more intensive facilities dedicated to psychiatric treatment, but it's a real concern because I don't know that the jail is really the right place, but they're not safe among the people.
No, but then they also end up with the stigma of having been jailed. Which, I was just wondering if there's a way to avoid that in cases where.
Well, I think 988 will help. I think that having the Stride Center has
Yes,
helped.
yeah.
But I think it feels like there is a lot of really unmanageable mental health issues going on. And I absolutely agree that we need to do something to foster those kinds of resources in our community to try to improve the situation, not just in the criminal justice system, but in our community as a whole.
We have a great community and we have a community that has a lot of programs and services. So whenever you offer those types of services and programs, you attract a lot of people. So unfortunately, we attract a lot of people that have mental health issues. Over 40% of people that have mental health issues have encounters with law enforcement. And that's a pretty large number.
Big number.
And as Eric said, the jail is not the right place for them. We're not trained to deal with mental health issues.
That's a big
Well,
But
bit of the
unfortunately, we
16th
have to.
century.
And you remember that in EPIL's report, on page 37, she added a 6th intercept for us. So the SIM intercept is 0 through 5, 0 is community services, 5 is community corrections. She said this report follows a SIM framework, but expands it to add intercept 6, addressing community-based substance use disorder and mental illness treatment to prevent crisis and criminal interactions from happening in the first place. Improving these community-based services at Intercept 6 will prevent individuals with these disabilities from encountering the criminal justice system at all, thus reducing costs to the county and trauma and collateral consequences to the individuals. We acknowledge that not all of our recommendations are within the Monroe County government's sole power or authority. Certain recommendations may require involvement or even leadership by other entities. Building on this report, a SIM process could help generate the shared vision, goals, and commitment to allow all the needed stakeholders to play their important roles and to prioritize the stakeholders' implementation of this report's recommendations. So she's recommending we work with our community stakeholders and build, at least encourage them. Yeah, and so that's I think a super important part of her report. Jennifer?
I know April had her, it was gonna say
I was
something.
just gonna say, as we're talking about it, I think there are two different things that we can kind of separate out, and there's the location of those mental health services. But also maybe another question we need to be asking is the timing of evaluation. And I think as we talk about those temporary holding areas, and specifically, can we quicker or sooner evaluate individuals who are coming into the jail for mental health issues to be able to, I think you mentioned, divert them to appropriate services. And I can tell you, as you go through a case process, knowing as quickly as possible that there is a mental health diagnosis or issues allows us to connect some of those community resources sooner. So if we had a section that talked about, if we had a working group that just talked about the temporary holding areas, whether inviting some of the mental health providers in the jail, like talking to, for example, Jim Bond, is understanding how quickly does the jail evaluate someone when they come in?
Yeah.
If there's a mental health issue, and is there any community partners that we could work with to maybe kind of address some of those needs and
Yeah.
services?
I think the timing of it is key. I think you're absolutely
Yeah.
nail on the head. Getting it done as quickly as possible and getting that person to the right service. Because I, as a county attorney, I did hear complaints about like, hey, we all got lumped in this one cold, super cold room. And there was clearly somebody who was having a mental health crisis over here. And, you know, and again, I'm not trying to blame the staff. You've got a facility issue. And we don't have the right facility. We also have to think about our mindset. I think we've talked about this before, when we hire individuals throughout county government, but especially in justice served positions, that do we have a service mindset? Do we have a compassionate mindset? We really are trying to understand we've got people who are dangerous. But, and we can't ignore that, but, you know, how do we, again, catch a child, how do you deal with it? Peter?
So in response to your comments, we did just get a new form from our medical provider that I think we're going to utilize with staff to start asking at the time of booking. Now, things you have to remember with that is, are they going to be open and honest with us when we ask questions? So, you know, that's something that we always have to deal with. You know, if they don't tell us the truth, if they don't divulge information, it's hard to go through that questionnaire and do it accurately. Second thing is, I'm working with PAC right now to get a program coordinator, and this person would deal a lot with recovery and reentry. And from the time that the person comes in the door, they would meet with all the inmates, start working with an exit plan. You know, what kind of services do they need while they're in jail? What kind of services do they need while they're out of jail? And then start working with other components, either in the county, probation department, Centerstone, wherever, to try to get those people located once they work through the system, or as they work through the system. So we're trying.
And I did mention that I heard about that, and I told Peter we talked before the meeting, yeah,
And it's in both of your inboxes, the details.
yeah, that we'll talk and pull the courts into that, because obviously we have a, you know, big role to play in reentry. And figure out, you know, what does the county, you know, what's gonna work for the correctional center, what's gonna work, for, you know, the courts. But I think, yeah, I mean, I think we've got to, and you say, you know, if they're not honest with us, sometimes it's just obvious that there's something not that's not quite right.
Sometimes it is, especially with serious mental health issues.
And I think that's probably what Eric is talking about. There are some people with some pretty significant issues. It's not just a little bit, it's pretty significant. And is that, I don't want to put words in your mouth.
Yeah, I mean, I don't know what the answer to that is. I just know that the hospital psychiatric ward feels that they aren't capable of dealing with it, and it ends up a jail problem. And it honestly, like, I think that the courts and my staff are sort of at a loss at what the best thing to do is.
It sounds like we should probably be working with the hospital and trying to figure out what is needed, because if we don't have the right facility or services, where are those, and do we need to work on something here?
Something that I
agree.
that I recently learned is that the hospital is mostly staffed with what are called visiting nurses, and they aren't actually employed by the hospital on a full-time basis, but are brought in where, and it's mostly because of nursing shortages, but also maybe because of the compensation. And I kind of got the impression that those visiting nurses don't necessarily have the same devotion to good care. And that, that could heavily affect psychiatric ward.
Yeah, absolutely. Peter?
So Ms. Bird
Yeah.
is typing a lot in
Yeah.
the chat and they made a very important, I think, contribution to this conversation where they were discussing Medicaid reimbursement.
Yeah.
And if you read Eve Hill's report, which is available on the website, she goes through the reasons why in Indiana, jails cannot receive Medicaid reimbursement for what they do. And I guess my question to this body is, if we're talking seriously about a new facility that treats mental health, are we building something that is going to be eligible for Medicaid reimbursements?
Well, we certainly would be, yeah.
And so, that's something that I think we haven't really broached, because I think as we've been thinking about this in the council, we've been thinking a lot about revenue streams coming from tax revenue or bond revenue. And so I think that takes us to a different level.
Mhm.
Yeah, absolutely. Eve touched on that in her report, and there was this 2019 report from the state jail overcrowding task force. And it said, now their seventh recommendation said, criminal justice involved individuals experience gaps and delays in accessing treatment services when Medicaid and Veterans Administration benefits are terminated during incarceration. Additional gaps in service delivery occur as individuals are transferred between and among facilities and community-based programs. Their sixth recommendation talked about resources within each county varying widely. And so we obviously, I know that's one reason why the JRECs are having this mental health summit towards the end of the year. I like to think that we could compile a team of, again, as you say, within Monroe County, we're one of the counties that have the most resources. Why can't we, I think as a government lawyer, I've always thought we have a lot of flexibility at the local level. We have, at this point in time, we have enough resources. We have human resources, we have financial resources, we have the willpower to do it, we have flexibility, we have home rule. Why is it that we can't figure some of these things out? I would know we spend $1 million a year on our medical contract for the correctional center. I would love to see somehow that we work with, maybe our current provider works with Health Net. The county also gives money to Health Net now. Why can't we have some continuity of care, in the community? So that things, you don't drop off when you go into the correctional center, or, drop off when you leave, that there aren't those, as they say, those gaps and delays. We need to address those.
If I can.
Yeah.
To kind of tie this all in, because I think Kate also said this, and in talking about this, I think my issue with all of this is the fact that I think this is just my opinion, we have to move away from the idea of mental illness and criminalization all in one big component. I think that is a big thing that, in talking to community members and things like that, I know that we have programs, and I know that that's something that we are trying to move past, because we have lots of folks in our community that have substance use issues and all different things. And, one of the biggest things that we have is mental health episodes and issues. But I personally would like to see us, whether, we work with the hospital or other health groups or social service or social worker groups as well, to maybe personally look at moving a facility outside of jail, and deal with those crises. I think that is the biggest thing. And I know, I don't want to speak for Ms. Bird, but I know I'm paying attention to a lot of conversations and talks, and I think she has mentioned this, and some of the things that I've seen her talk about is that's the biggest, that's an issue.
Yeah.
So we have to move away, and if that means that we have to think about moving a facility out and having a facility specifically for those that are having issues with mental health, and having to deal with them so that they don't go into the system. I think that is something that we could do, maybe in terms of just brainstorming out there. Like whatever happens with our current facility, soon to be old facility, I don't know if that's something that we could possibly do.
Mhm.
But just putting the two together really kind of puts a criminal component on it, and we really should move away from that.
Yeah, I 100% agree. And I also think, so you're talking about, sort of like a different mindset. You're totally thinking about a shift in our focus in the way we treat people. I have a 27-year-old son with disabilities, and he's always had an IEP. We've spent his whole life doing person-centered planning. And he's got it's a Medicaid waiver, and the money follows the person. I would love to do person-centered planning and our resources following the person, rather than being so arbitrary and saying, you got, you go here, you go here. We need to, again, we say this a lot, meet people where they are, provide them the services they need. Eve said over and over again, she said it at our opioid summit when you guys were on that panel, which was, don't get all locked in this bricks and mortar, like this, people can't always go over there. And so we've got to be flexible and nimble. And that's the beauty, I think, of local government, is we do have a lot of control and a lot of resources.
Yeah.
And I want to talk more as this process goes on about what we can do, not what we can't do.
Yeah, and I think of my son, because my son also has an IEP, and where he's 10 and he is a young Black male right now. And I look at him and I've already seen people already try to criminalize him. So when we think of that school to prison pipeline, I am thinking, and coming from a personal place of experience, where my son, people mistake him as being this mouthy little 10-year-old who doesn't respect authority, who could care less about what people are saying, when in actuality, he really is trying to get to the bottom line and try to understand. And so it almost feels like he's going back and forth with somebody, and he's really not. He's really trying to understand.
Sure.
And so for those that are having those episodes in a way that, they're just misunderstood, and people are automatically overworked, underpaid, and short-staffed, and all of the above, the last thing they want to do is to deal with somebody who is having a mental health crisis at the moment, and we just automatically just push them to the point where we're done here, move on.
Right.
And I feel like that's where we have to, in our little progressive old community that we have here, we have to look at that and figure out how we can move away from that component.
Because that's when tragedies happen.
Yes,
When
yeah.
when the person gets frustrated, said, okay, now I'm in charge and this is what we're gonna do. And that's the tragedy, and we can't have that. So,
But I also think there's a problem basically just in that so many mentally ill people start self-medicating, which leads to drug problems, and the drugs are illegal. So basically they're in trouble because they're mentally ill. And somehow that needs to be separated out from people who are simply abusing for the fun of it or whatever they do.
well, and think about too, we've said this in a previous meeting, we should be lobbying at the state level and working with our state legislators. And, we know we have relationships with them. We also have a lobbyist, so let's be keeping, and you're totally hooked in with the state. Mary Ellen is hooked in. We've got, a lot of people who have state connections. Again, I think one of the things that Peter Ben is proposing is how do we work with the state? These are issues going on at the state. They're looking for solid partners as well. And we look pretty good generally to the state. We're often picked as the pilot county. So how do we develop something that we can see if it works here, it could be replicated across the state? And, again, when I was talking to Peter, he's like, yeah, if you had data, wouldn't it be great if you had data from multiple counties? It's not, when you're doing research, having data from just one county is not ideal. So again, Indiana University has some connections. Let's pull together and collaborate and partner and come up with some solutions. Okay, I want to make sure I'm not missing anything. We are reading your chats, by the way, so, and thank you for those.
And Marjorie, since we're making a list
Yeah.
of additional areas in the jail, can I just add a couple of
You may.
information?
Please.
A kitchen and commissary, I wasn't sure what section that falls under, but if you can include that.
Yep.
A library, especially making sure they have adequate books. Meeting spaces, I know we identified meeting spaces on here. I actually separated them out from classrooms.
Okay.
Just to kind of flesh out what those can mean, being able to meet with their attorney.
Yes.
Making sure there's some spaces available. Because the longer you have to be able to meet with the attorney is going to delay the process, so making sure we have some established places to meet with their attorneys.
Yeah.
Making sure there's some spaces for meeting with visitors, which is separate. Meeting with pretrial release, that was mentioned in the report. Just keeping in mind that pretrial release is doing those evaluations and being able to do those evaluations timely also, I think has an impact. If we're looking at recommendations, how to move forward, including identification for treatment programs, treatment courts. And lastly, a meeting space for connecting to the courtroom. Just something to think about. If, for example, someone within a block gets COVID or an area gets COVID, that may result in that area being quarantined for a period of time. But being able to still connect to that individual, if they have a hearing the next day, if there was technological ways, so to do that, that's one option. And also during the pandemic, we would have sometimes a defendant's appearing by initial hearings through it wasn't Zoom, but through kind of that remote process, but having that more established so everyone can be able to see what's going on as we move forward, to making sure we can connect them to courtrooms consistently and safely, because also the jail is having to transport them to even those spaces. So that's just wanted to flesh that out.
We would love for that.
And that has happened, I think, on both ends. So I think the reason it was problematic, the way we had been doing it, is that where the screen was in the courtroom, the public defender couldn't lay eyes, the prosecutor couldn't lay eyes on the defendant, and vice versa. So it just wasn't an optimal setup for everybody to really feel like they were seeing each other, hearing each other, reading cues, those kinds of things. And so you have to think about positioning it in the jail so that it's convenient and safe for jail use, but also positioning it in the courtroom so that it's actually functional in a meaningful way.
And I think when we think about who's going to be talking about and helping the designers, the architect, the builders, we definitely have to have defense attorneys, prosecutors, judges, who else?
Anybody on the
Administration.
intercept system? That whole,
But I'm thinking right now, of like judicial hearings, would you probation?
Whenever you're ready for a demonstration, let me know.
Yeah,
'Cause we've got a company that can do it.
well, we are
It's not a
going,
decision I get to make, piece of care of it. I love it.
Well, but you should have a say in it.
well, who's your company?
WebEx, I believe. They're located in Evansville. So we went down and it's what Vanderburgh County uses.
We're definitely gonna have to build technology in. I remember being a pro tem in another county and they had better technology, smaller county, and they had better technology than we had here in Monroe County, which is not. So we could definitely do an upgrade. And again, one of the thoughts that I've heard is, okay, do we, has the decision been made that we're gonna have everything co-located in one space? Or are we gonna have the housing in one space and the professionals, the attorneys, the courts, those courtrooms in a separate space? A lot of counties do that latter approach. We are going to have to decide how we want to do it. I think everybody thinks ideally it would be in one location. I've heard that from a lot of people. We'd like a campus, we'd like things co-located. But it's certainly if you have the majority of courtrooms and prosecutors, public defenders, probation, et cetera, somewhere else, you'd want to have, and you and I talked about this, we'd want to have at least a courtroom, if not more than one courtroom, and some things already, there with the housing. So that decision, does anybody have thoughts about that? About, you know, 2 separate sites or 1 central campus?
Yeah, this would actually be helpful when we go through and have those meetings where we talk about what the courtroom looks like and what. And have individuals follow the public defenders, follow the prosecutors. You can see some of the ways that there's sometimes delays in hearings because there's transportation challenges.
Okay,
So maybe being able to see those or some of the technology challenges. You guys can figure out what's the best way to move forward, because even if they're 2 different locations, you still have instances where those who are incarcerated might have injuries. Might be have to transfer it in a particular way, or to think about how you're transporting them. Once again, if there's a block that's shut down or quarantined for a period of time, making sure they maintain access. And that's going to be something that's going to be needed, whether or not they're in 2 different locations. So it might be helpful to have some of that information first, just a suggestion.
before we have this conversation.
And the last area I wanted to add that I didn't see on here, and I just, is an emergency relocation area.
Mhm.
In the event of emergency,
Yeah.
if any individual block or the jail needs to be relocated, making sure there's some safe spaces.
Which was
For
what
safety.
our basement of our, which is
That's
now
right,
the Stride
Stride
Center,
Center.
that's what that was designed for.
That's
So
right.
yes, thank you for that. So I have the emergency relocation center, library, kitchen, commissary, space for meeting with attorneys, visitor space, pretrial release evaluation, connect, you know, also thinking about connecting courtroom technology.
I'd like
Thank
to
you.
add,
Yeah,
I know when we have went back in, was it March? Some time ago. I think I had asked the question of like hold-in rooms for those that are trans. And there wasn't, I know you had mentioned like they're really kind of struggle with that because of various things. I think that also is something that we should consider as well.
Yeah.
Because we have,
yeah,
trans folks in our community, and if they have to be, incarcerated or held for whatever reason, they should feel comfortable and feel safe where
Mhm.
they are.
Yeah.
So that's also something to think about too.
And I think I recall having conversations with Linda Brady and probation about some of this, and I know that they sometimes have been ahead of the rest of us in the county on dealing with some of those issues and having policies. And so that's definitely, I highlight that as something we definitely need to think about when we're building out space.
I think we also kind of need to think, it may be more of a short-term problem, but there still are a lot of people who are really uncomfortable with technology.
Yeah.
And
Oh,
just
yeah.
feel intimidated by having to deal with it, and because of that, maybe don't present themselves as well, or
Yeah, it may, that you're saying that hearing may go differently or things may go differently because of that. We don't want that to be the cause of a
No.
different decision being made. Yeah, and I think even, I know some judges who say they like face-to-face interaction. They feel like they have, more honest communication that way. But I remember taking Eve Hill up to, and I've mentioned this before, up to some initial hearings, and there was a long delay, and many of your employees were tied up. And that may be some of, who knows, I don't know why there was a delay, but a lot of your staff was tied up, like, multiple jailers were tied up there for hours. And so maybe it was just a bad day, but I think, we've got to think about where stuff is and how maybe people can continue to be doing their business, not just sitting there, waiting forever. I don't know. So it's 5:53. This has been a great conversation and a great chat. Thank you for people who are on Zoom, and I apologize if it appears that we have not been paying attention. I am going to put my information in here. My cell phone, which is my work phone, and I welcome people reaching out to me. And I'm gonna put my email in here. That is a small m. It's a small m at the beginning. Margie at dobbslegal.com. I welcome, because this is a working committee of council and commissioners, it's not a task force. We covered this at the NAACP meeting. There's not a current mechanism for, community input. We're trying to keep the council and commissioners focused so that we get these studies, implemented. That doesn't mean we don't want community input. It doesn't mean that we're not gonna take community input. But at this current time, I'm welcoming as many people as who wants to reach out to me so that, and I'm having coffees and Zoom meetings and phone calls. We will, have community input sessions as we move forward. I'm sure we're gonna have charrettes. But for right now, reach out to me with thoughts. And don't see contact information.
Oh, because it only works on hosted panels.
Oh, duh. Everyone. Okay, let me try this again. Oh, Kate did it. Thanks, Kate. You're awesome.
welcome.
Okay. So, one thing I want to mention, because Reverend Vance is here and Jennifer, both of you guys jump in. One thing, and I appreciate the NAACP stepping up. They've agreed to have a subcommittee form to review these reports and give us collective feedback. That's huge. That's a perfect model, I think, for other organizations to do the same. Read the reports, and give us your feedback. Again, we want feedback. We can't do this without community input. This is not, these are not just county issues. We've got to have the city's input. They bring more people to our facility than any other law enforcement agency. We've got to have input from all different groups in the community if we're going to get this thing right. So the last thing, or one of the last things I want to make sure we do is I did talk with Peter Fenn and he talked with Mike Andrus in Hawaii. And they came up with a consulting proposal that I'm gonna hand, I emailed it to you, but I'm gonna hand out some copies too. And I want you to think about this. Obviously, this group doesn't make decisions, but would ultimately, I think, make would make a recommendation perhaps to the commissioners. I think we have to think about getting somebody like Peter Fenn and Michael Andrus in on the ground floor, helping us, and they've laid out sort of how they think they can help us to work with the university, to work with the state, and to evaluate what we're doing. One of my goals is that we learn through this process that if we are being effective with the resources we've already put in place, or if we could be more effective. Every year we do an annual budget, and it's hard to tell if what we're doing is effective. When our jail numbers are continuing to go up, I wonder sometimes, should we be pivoting? Should we be doing something a little differently? And having an outside entity evaluate, I mean, that's, Erica's working with a consultant right now to evaluate sort of her work, which is brave, I think, to be able to say, hey, I'm opening up everything, take a look, tell me what's good, tell me what's not good, what can use improvement. And I think we ought to have some evaluation on that in terms of mental health services too. Julie?
Yeah, and I can see the value in that, but I also feel like I don't know where to draw the line. Like, we want to hear from everybody, but we're not going to hear from everybody. So
Yeah.
how do we get the best information possible? But I think we should, before we do anything with trying to, book in consultants, I think we should get in touch with the National Institute of Corrections.
Yeah.
As a first step.
Yeah.
I think that would be a better, my personal opinion, it would be a better first step. Because they may say, yeah, you should bring in somebody to evaluate the mental health side, but I really like the fact that they're already helping guide this process for a number of other communities. Were they in the Franklin County, Ohio? Yeah. So they're already involved in these other communities, and you know, why do we need to recreate the wheel
Reinvent the
here?
wheel. Yeah, I don't, and absolutely, I will definitely, I wrote that note down to check with them and see. And maybe they have all the resources we need. I just want to make sure you know that this resource is out there. And we had touch base with Peter years ago, trying to do that grant proposal. And I really would like IU to be part of our team. I think it's a shame that there's not more collaboration on these issues between the university and the county, because I think they can stand to learn a lot from us. And again, when we think about building talent and we think about keeping some of that talent here and building those resources, we've got this wonderful, you know, educational institution in our backyard. And I can't think of many ways that we're collaborating with them.
I agree.
And we should be really developing that relationship.
Right, but what if they already have an example of that kind of collaboration with the university somewhere, right? I mean, that's what I'm saying.
Yeah,
It's like,
yeah,
why
and
not
then- but
ground
we've gotta get-
floor,
yeah.
start there and then talk through who we need for mental health.
Yeah.
And Angie just texted me and said she's going to send some other links
Good.
with some more information to you, Margie, and then
Okay.
you can send it out to everybody for
Yeah,
things to read up on.
I think that's great. Yeah, and I think that if they have great models, we should definitely utilize those. But we've somehow got to get some buy-in from.
Oh, yeah.
From the university. And again, I'm gonna make a note again to revisit that idea of the survey with Indiana Institute on Disability and Community. I know Angie and I worked on that proposal. And see if we either, if not this year, next year, when we will have a new sheriff, maybe that new sheriff will have a different perspective or a new perspective about a survey or how to do that, but definitely think we ought to revisit that issue.
I think we don't want to wait on getting input from law enforcement, jailers, the sheriff's department. I think we need to actively be thinking about how we're gonna get that input and start gathering that input. What we do with it is another story, but that's gonna take some time. And that's gonna eat into the process of
About
everything
this,
else we're doing.
about facilities and programs, you're thinking?
Right,
Mhm.
yeah, there, you know, what works and what doesn't right now. You know,
Yeah.
is, you know, what would you love to see? What would you hate to see, you know? But having those interviews is gonna be so important. So we can do, you know, small group, focus group interviews while they're at work. That would be even better because they're thinking about work, they're there at work instead of having them do extra things outside of work. But really I just think if we wait until we make a decision regarding property and design, we're
Oh,
already
yeah.
gonna be behind.
No, I agree. And that's what I don't think we can wait. I mean, I think we have to be juggling all of this stuff
Yeah.
at the same time. But you know, like April had mentioned, doing jail tours, you know, talking to the road deputies. There's, you know, and I wrote down that list and you're gonna send it to me. We have our work cut out for us.
Mhm.
Let's not, you know, let's not pretend we don't, because we have a lot of things to do. And this was a great meeting. I appreciate all
Thank
your
you.
input, and I wanna end on time. Anybody else, any last stuff for the good of the order or whatever?
I'll
they say?
This is-
be at
I
the
think-
next meeting via Zoom.
This is fantastic. More evidence-based
Yeah.
practices we need to be implementing in county government.
Absolutely.
I
Okay,
think we should also talk to the jail social workers.
okay.
I think that was one of your goals.
Yeah, it was too.
Okay, I missed that.
Oh, I don't know if she said it, but it's more written.
Oh.
Linda Grove is gonna be here next time to
Lot of
talk about the
expectations for your
Scribe
list.
Center and how to fund and budget.
Linda Grove is gonna be,
4:08 or 9:80.
Paul's gonna be here, and I don't know yet about.
I haven't heard back.
Okay.
I'm still working on
Okay,
it.
but
So
988 and.
Yes, it may
Okay.
be, have to be because we're at Linda Grove Fall, we may need to bump it to the August 3rd or August 17th.
They're going to move into their new facility early September, so he's wanting to try to get it done as soon as possible.
Okay, and I'm looking here, no perspectives outside of Christians are there. Yep, okay, thank you. Okay, thank you. Please reach out, anybody who's got input. Ms. Bird, I'd love to hear from you. Thank you.
So you would really enjoy.
Thank you. And take care.